So to help us lead the conversation on mental health is Toronto rehab expert, Dr. Martha McKay. Dr. Martha McKay is a Toronto rehab clinical psychologist affiliated with our spinal cord injury rehab program. Prior to joining UHN, Dr. McKay spent many years in the mood and anxiety program at the Centre for Addiction and Mental Health, involved in numerous studies investigating various treatments for depression, and where she completed her doctoral research and postdoctoral fellowship. Please welcome Martha McKay.
Hello, thank you, Arlene. It is my great pleasure to be here today and to participate in this wonderful event. Let me just get myself situated here. Okay. So last year, on Bell Let's Talk Day, we had a great conversation about depression and anxiety with a focus on the science behind it. This year, we wanted to continue that conversation and expand on it to include a discussion on mindfulness practice.
Sorry, I'm just going to do this, Martha.
Oh, what? Oh, okay. Thank you, Arlene. We wanted to expand the conversation that we were having and to include a discussion of mindfulness practice, which has shown not only to be helpful in the treatment of depression, but also has a powerful component of stress management and self-care. So my role today, starting off this wonderful event, it's a tall order. I'm going to provide a brief review of depression, what it looks like, treatment, and the role of self-care. Including some things that we learned last year as well. So why are we having this conversation about depression? It's a very important conversation to have. It is a common disorder that greatly impacts many individuals of various ages for various reasons. It has a significant impact not only on individuals' life, but also a high disease burden on a global scale. So the World Health Organization estimates that 264 million people suffer from depression worldwide. In Canada, annual rates are approximately 5%, with a lifetime rate of approximately 11%. And while many individuals experience depression, there are some who are more likely to experience depression. So we know that women are more likely to experience depression, as well as different age groups, including older adults, and youth. We've seen an increase in rates of depression for adolescents and transitional ages, which is an important treatment consideration. So, as I mentioned, there's worldwide, there's a global scale of the burden of depression. It is a leading cause of disability worldwide, and that's true for Canada as well. It comes with significant cost to healthcare. In Ontario, it's estimated that approximately $210 million are spent on depression. But not only does it cost the healthcare system, it also can cost the individual themselves. Not all treatments that are known to be effective for depression are covered by an OHIP and come at a cost to the individual. Depression is also associated with an elevated mortality rate due to psychosocial, behavioral, and health-related determinants. But also one of the core symptoms of depression is recurrent thoughts of death and suicide, so it does come with an increase of risk for suicide. Depression often co-occurs in the context of another medical condition or illness, and here at Toronto Rehab, we do see this as well in the context of injury. So particularly with my role, we do see this in spinal cord injury. It does have a great impact on your work, your occupation. High prevalence of unemployment, disability, and absenteeism are seen amongst individuals who experience depression. There's lost productivity both in absenteeism, but also reduced productivity while you're at work due to symptoms of depression. And lost wages, the estimate costs are approximately $32.3 billion annually. So what does depression look like in individuals? So Most of you know that depression comes with an emotional component. People living with depression experience persistent sadness and depressed mood. However, some may not know of the other symptoms that can occur with depression, including physical, behavioral, and cognitive. So as you know, the emotional symptoms associated with depression are persistent sadness, also loss of interest and pleasure in things that people normally enjoy, otherwise known as anhedonia. So as a result, people may stop doing things that they used to enjoy, they may withdraw socially, and even if they do participate in their usual activities, they still don't derive the same pleasure from it. Also, irritability can be seen with depression and is often noticed by others, as well as people often begin to question their self-worth and experience excessive and inappropriate guilt. Okay. So some of the physical symptoms that come with depression include sleep, appetite disturbances, fatigue. Some people experience psychomotor slowing, so they move and talk more slowly than what's normal for them. Also, the cognitive impact of depression, it comes with poor concentration and attention, can impact one's ability to make everyday decisions and also impact how you view the future, and people tend to become hopeless. So, knowing that it impacts all of these areas, the other thing that is common with depression is that the symptoms, the way they present may vary from individuals. So some symptoms can present in opposite ways. So sleep disturbances, some people may experience insomnia, or other people may oversleep, so sleeping 10 to 12 hours per night and still not feeling rested. Same thing with appetite. Some people lose their appetite, some people overeat and gain appetite or crave specific foods. Anxiety is often common with depression, and that can present in different ways. So experiencing symptoms of anxiety like worry, full-blown panic attacks, and sometimes depression coexists with another full-blown anxiety disorder, say, for example, social anxiety. So having said all of that, two individuals with depression can look quite differently. So what do we consider, what's normal sadness versus clinical depression? We all experience sadness. We're human beings. Our day-to-day isn't all rosy and happy. So how do we distinguish that? Well, what we do is we tend to look for duration, intensity, and impairment. So how are these symptoms or cluster of symptoms persisting? Do they cause interference in your everyday life? And how severe are those symptoms? So with respect to a depressive episode, in general, the diagnostic criteria would include 5 or more symptoms, one which must be depressed mood or anhedonia, with a collection of the other symptoms already mentioned: appetite, sleep disturbances, energy issues, and recurrent thoughts of suicide. In addition to that, there are different types of depression. So today we're really talking about unipolar depression, but depression also can occur in the context of bipolar disorder. It can occur with other symptoms like psychotic features. There are different types of depression dependent on cluster of different symptoms like atypical and melancholic, and it can also occur at different times and under different circumstances. There's a seasonality component to it and can occur within postpartum. What I wanted to highlight here today was that it also is a recurrent, it can be a recurrent disorder. So while many people may experience one episode of depression, that is not typically the course that we would normally see. It's often recurrent, and when it becomes persistent, that can lead to difficulties with respect to finding the appropriate treatment, but also a greater impact on quality of life. So, as you can imagine, knowing that depression can look differently in other people, there's different types of depression. What causes depression can't be boiled down to one single cause, and indeed that is the case. It is thought to be a complex interaction between social, psychological, and biological factors. And indeed, the search to establish the pathophysiology of depression and search for biomarkers has been quite challenging. So even though I'm glossing over this due to my time restrictions, This slide really represents decades of research looking into what causes depression. So there's various things like genetic component, the biological factors that include imbalances in brain chemistry or neurotransmitter, molecular level concerns and differences in those with depression, and also influencing other systems like the endocrine and immune system are thought to be related to the cause of depression. In addition to that, the neuroimaging studies have shown repeatedly that there are a number of different areas that show different function and structure in relation to depression. There are also psychological and emotional vulnerability to depression, so different cognitive biases or thinking patterns. There's also a component of stress. There's a strong link between stress and depression, which I'll touch on briefly. So those who have a history of trauma, childhood trauma, or experience prolonged or chronic stress or adversity, there's a link with depression as well. Depression is also related with physical illness, and again, in our context here at Toronto Rehab, we certainly see this in reaction to injuries that we treat here. Okay, so how do we treat depression? Well, there are a number of known effective treatments for depression. So one commonly known is psychotherapy or talk therapy. So that can include things like cognitive behavioral therapy, and later to include mindfulness component of that. Interpersonal therapies, behavioral therapies, and acceptance commitment therapies all have been shown to be effective treatments for depression. Certainly there are medications that are helpful in the treatment of depression that you've likely heard of. So a lot of the antidepressants, so SSRIs, SNRIs, and other strategies. In recent years, with newer treatments coming to light, things like ketamine and other treatments for depression. There are also brain stimulation therapies that are effective in treating depression. So things like repetitive transcranial magnetic stimulation, and also electroconvulsive therapy is used for the more refractory and treatment-resistant depressions. And in recent years, just even my own experience working in this area, we've seen an increase in overall health strategies, looking towards those as potential treatments for depression. We'll talk a bit about those quickly. Okay, so how do we access treatment? A good place to start in general is with your primary care physician. So that is the source of a lot of referrals to other programs and to other clinicians like psychiatrists who would be able to do an assessment and treatment recommendations and prescribe medications. Psychologists, psychotherapists, and social workers are all individuals who provide talk therapy or psychotherapy. Again, but those individuals might be come at a cost and maybe cost prohibitive and unaffordable for some individuals. There are also hospital-based programs. Here in the GTA, we have several mood programs that offer a wide variety of different treatments, including access to treatments that are currently under research. So, in terms of, because of some of these limitations that we can see in our healthcare system, as I mentioned, there has been a shift to looking at other strategies that may be helpful in the treatment of depression. So looking at the role of different things that are often discussed when talking about self-care. So you've likely heard of many of these strategies before, and you're probably thinking, Martha, you don't have a lot of time. Why are you talking about self-care? Well, the reason I'm talking about this is because individuals with depression, due to some of their symptoms like fatigue, loss of interest, and motivation, may not participate in some of these things like overall health strategies. But we know that they do have mood benefits, and in fact, some of them have been looked at as an intervention for depression. So for example, sleep. We all know the importance of sleep, getting enough sleep, and we know that this does have beneficial effects on mood and mood regulation, and as well as cognition, which are all obviously impacted by depression. In terms of physical activity, many investigations have studied the efficacy of things like exercise in the treatment of depression. So both cardiovascular and resistant type exercises have been shown to be effective in reducing depressive symptoms. In fact, it is included as one of the first-line treatments for mild to moderate depression in Canadian treatment guidelines for complementary treatments for depression. Indeed, yoga has also shown benefits in terms of its efficacy in treating various symptoms of depression. It's been effective in comparison to treatment as usual, with some suggestion that things like breath control and meditation are particularly beneficial. I myself has been involved in a number of yoga studies, and we've shown that it can be beneficial into other group treatments like psychoeducation. And diet. Diet has also been an area that we're all familiar that is healthy to eat a certain diet, but it also has been investigated looking at the connection with depression. So there are complications that are associated with some of the symptoms with depression, so overeating, and there is a connection between obesity and other factors like emotional eating that can lead to other comorbid, complicating medical factors associated with depression. So the interest in looking at specific diets has come about, and there also is a link between poor diet and the risk of onset of depression. So there have been correlational studies and some investigation towards specific diets like the Mediterranean diet, which is foods that are rich with monosaturated fats, fiber, and omega-3 fatty acids. However, the evidence for this has been somewhat mixed. Right now, I think the recommendation is to adhere to a healthy diet in order to reduce some of the other medical complications associated with depression. The other area that has shown to have mood benefits and can be beneficial in health, in self-care as well, is the benefits of nature. So studies have shown that in comparison to walking within a city setting, walking in nature resulted in positive mood benefits as well as cognitive benefits. And for those who have talked with me before, I'm often talk about forest bathing and trying to get that program at Lyndhurst, an accessible forest at Lyndhurst. Okay, so as I had mentioned before, there is a particular role between self-care, between stress and depression. And why we talk about this when the role of self-care is stress management. We all know that this is a very important piece of self-care. So the connection between depression and stress is longstanding. Individuals with stress have varying perceptions of stress that are different for non-depressed individuals. People with depression tend to use emotion-focused coping styles, and these are certainly targets when we talk about psychotherapy. There's also association between stressful events and the onset of depression, and as well as your physiological response to depression, so your HPA axis or hypothalamic pituitary adrenal axis. There's long-standing evidence to show that that is dysfunctional and different in those individuals who experience depression. So the importance of stress management is not only important for those individuals with depression, it's important for all of us. And indeed, coping strategies are a focus of psychological intervention. So problem solving, goal setting are essential ways that we control when we're feeling overwhelmed. We certainly teach people how to engage in these strategies. Relaxation techniques are often something that we know can benefit mood, and many individuals experiencing many different, different stressors and different issues. And of course, mindfulness, which you'll hear more about, so I'm not going to say anything further about that, but it can be difficult to take the time to incorporate into our lives these types of stress management issues. But I think when we talk about depression, it is a recurrent disorder, as I mentioned before, which can have a greater impact on individuals' quality of life. So it is important to look at positive mental health strategies and prevention. And so in building resiliency. So the importance of the recognition of the symptoms of depression, for early intervention. We know that early intervention is beneficial. And in that it is important that people seek professional help. Well, we know there are limits and barriers within our healthcare system. The help is there, and depression is treatable. The other piece is staying connected, so reach out to someone that you trust. And if you are the person that someone has reached out to, we would encourage you to listen with openness and without judgment. So, the importance of managing stress, not only for ourselves and our own self-care, but also for people who experience depression. One of the cornerstones and powerful practice that can promote positive mental health and manage stress and help with the symptoms of depression and prevent relapse of depression is, of course, mindfulness, and which is why we are talking about this today.